I'm Nidhi Ahir, a peer health educator at Sunday Fitness and Wellness. Although it can be challenging, we need to continue to be committed to public health now more than ever. A positive COVID-19 test may bring about shame or guilt. However, this is not something we should be ashamed of, but we must work together to manage. This means being as honest as we can to those who have been exposed to prevent the further exposure. This is our collective responsibility to keep our community safe. What should I do if I'm notified that I tested positive for COVID-19? Your healthcare provider works as a resource to help you guide through this process. If you test positive, you will be notified and your healthcare provider will work with you to answer any questions, talk about next steps, and how to identify who you may have been in contact with. It is very important to follow instructions from your healthcare provider and adhere to public health guidelines. If you test positive, you should isolate yourself for at least 10 days of symptoms onset until no fever is present and until at least 24 hours without symptoms. Self-care strategies are good for your physical and mental health. It can help you take charge of your life. Keep your regular routine. Maintaining a regular schedule such as getting up and getting ready every day, eating a variety of healthy foods throughout the day, getting regular exercise, and sticking to a bedtime routine is essential for your emotional well-being. Set aside time for activities you enjoy. This predictability can make you feel more in control. Limit exposure to news media. Constant news about COVID-19 from all types of media can heighten fears about the illness. Limit social media or other news that may expose you to rumors and false information, but keep up to date on national and local recommendations. Look for reliable sources, such as the U.S. Centers for Disease Control and Prevention and the World Health Organization. Stay busy. A distraction can get you away from the cycle of negative thoughts that feeds stress. Enjoy hobbies that you can do at home. Doing something positive to manage your stress is a healthy coping strategy. At the same time, don't become overwhelmed by creating a life-changing list of things to achieve while you are at home. Set reasonable goals each day and outline steps you can take to reach those goals. Give yourself credit for every step in the right direction, no matter how small. And recognize that some days will be better than others. Focus on positive thoughts. Choose to focus on the positive things in your life instead of dwelling on how bad you feel. Consider starting each day by listing things you are thankful for, maintaining a sense of hope, work to accept changes as they occur, and try to keep problems in perspective. Use your moral compass or spiritual life for support. If you draw strength from a belief system, it can bring you comfort during difficult times. Get help when you need it. If you're feeling suicidal or thinking of hurting yourself, seek help. Contact your primary care provider or a mental health professional, or call the National Suicide Prevention Lifeline or use its web chat. Should I notify my friends and family? According to current public health guidelines, anyone who has been in contact within 6 feet or less for 15 minutes or more should stay home until 14 days of last exposure. Maintain physical distancing at all times, self-monitor for symptoms, and get tested if they're able to. It is better to be precautious and preventative than risking the spread of the virus. How can I care for those who have tested positive? As a community, it is our responsibility to make sure that those who tested positive for COVID-19 feel cared for. If you know someone who is sick, be compassionate and supportive in their recovery. We should take care of them and make sure that they don't feel embarrassed. We can still practice physical distancing by calling in, setting up a time to do video chat, and sending a positive message to brighten their day. We can win this battle of COVID-19 by working together. What if I get a test and am awaiting my result? Should I notify those I have been in contact with? While you are waiting for your results, follow public health guidelines by staying home to prevent spreading the virus. It may be helpful to think through who you may have prolonged contact with and let those people and close contacts know that you have been experiencing symptoms and waiting for your results. Those individuals can monitor their symptoms and seek out for help if symptoms occur. Heading home or elsewhere for the holidays? During the COVID-19 pandemic, Sundays help protect the health of all regardless whether they are on campus or off. One of the ways we can do this is by getting tested prior to leaving for home or elsewhere for Thanksgiving and New Year's Day. By getting tested prior to leaving, you bring home peace of mind and prevent potential risk of the spread to family, friends, and then the larger community you're traveling to. Thank you for doing your part to help slow the spread of COVID-19 at ASU and in the broader community. By helping others stay healthy, you are contributing to community of care. We are all in this together and we will get through it. Be kind to each other and be safe.